Thanks a lot, everyone. I'm truly privileged for this opportunity. Thanks, Sunil, Abrar, Amit, for inviting me. It's such a pleasure to be among friends. I've known Amit, Sunil over a decade, and I've also known some of the founders that they were talking about over many years. I think Sunil made my job very easy. He already painted the big picture of what Asia Opportunity is about. They asked me to speak about, I've spent the last 25 years of my career across India and Southeast Asia, working across the healthcare ecosystem, working with pharma companies, working with hospitals, medtech companies, diagnostics. So hopefully I can bring some of that vantage point to the discussion today. What I wanted to do over the next 20-25 minutes is talk to you about three things. One is just zooming out and sharing the excitement that I feel with all of you about the overall opportunity in Asia. Second, then zoom in a little bit about what I see as some of the shaping healthcare trends for this region. And third, then just talk about specific opportunities. I have not tried to be comprehensive, but specific opportunities that really excite me at this time. So with that, let me get started. First of all, I think in a changing global economic landscape, Asia is right at the center of the transformation. It's about growth, and to just give you a very interesting data point on what this growth is about, what you see on the left is Asia, and what you see on the right is West, which is US and Europe. And you see the income pyramid. By 2030, the high-income households, which is households who earn more than $30,000 US dollars per annum, is going to be 175 million. 5 times as much it was at the beginning of the century in Asia. But more interestingly, it's going to overtake the number of high-income households in the West. So that's really defining what it means in terms of the consuming power, in terms of the aspirations, 175 million high-income households in Asia. But also interestingly, and we talk about this a lot, and Sunil pointed to this, there is a large bottom of this pyramid as well, the 485 million low-income households. The interesting point about these also is that many of these, across most markets of Asia, are going to be digitally native, even the low-income households. They will all own a smart device in some form or fashion. They will start to expect convenience in every aspect of their life, including healthcare. They are already used to doing financial transactions on their phones, and increasingly they will expect the same kind of seamless experience even as they consume healthcare. So that is about the economic growth. The second thing I wanted to talk about is trade flows. This is a study that BCG completed recently to look at trade flows across the globe, given how much is changing in geopolitics. So if you take a picture from 22 to 32, so the next 10 years, there's going to be a $7 trillion increase in the trade flows in the world, and 1.2 trillion of that will come from Asia. But not just the quantum of this, a lot of this is changing. It's a complicated chart. The breadth of the arrow shows how much the increases over the next 10 years, and the green says whether it's increasing at a good CAGR, and the red says whether it's decreasing. So one of the most defining, one of the most defining parts of the trade flow is going to be that there's going to be a lot of trade between China and Asian countries. That's the bold green arrow that you see, 600 billion of trade flows between Asia and China. Obviously, there is a reduction of trade between China and US, and Asia as a beneficiary of that trend. There's going to be a lot of increase of trade between India and the rest of Asia, and also India and China. So Asia is becoming, the unfavorable relationship between China and Asia is benefiting, China and US is benefiting Asia, and a lot of this investment is going to start to come towards the Asian countries. Another picture of the same, FDI. Asia, the FDI has been increasing at a 4% annual growth, and the rest of the world has been decreasing at a 4% annual growth. So there's an 8 percentage point delta, and with the power of compounding, that means that Asia now attracts 47% of FDI of the world, from a quarter just 8 years ago. So Asia has huge economic power. There's a high amount of high-income households, which starts to dwarf even the high-income households in the West. There's a lot of trade flows coming towards Asia, and there's a lot of foreign direct investment coming in Asia. What does that mean for healthcare? What it means is this grand macroeconomic opportunity also has a ripple effect on healthcare. And there is, therefore, going to be a lot of both public and private investment coming into healthcare. So if I just look again at the contours of what Asia healthcare is about, Sunil already spoke about this, 60% of the world's population resides in Asia, but also Asia carries almost 60% of the disease burden of many diseases. If you look at oncology, Asia carries 60% of the disease burden, but more interestingly, the top 5 cancers in Asia, of them, 2 of them are not the ones that are most prevalent in the West. So not only is Asia going to need more care, it's going to need different kind of care. It's going to need to develop its own solutions. And with this 60% disease burden today, Asia only comprises 20% or so of the healthcare spend of the globe. And this points to not what is today, but what can be over the next 10 years. A lot more spend needs to happen for the Asian population to manage this healthcare burden. And it cannot be managed in the same way that the West has managed it. Asia will need to invent its own solutions. And that is where, looking a bit far, and Sunil and others were talking about what they saw in some of the companies. There's going to be many, many of these opportunities of innovative models where companies are going to try to find their own solution to solve this healthcare burden in Asia. Put together, it means that over the next 8 years or so, the healthcare spend increase overall in the globe, 40% of that is going to come from Asia. So this is definitely the place with a lot of interest, a lot of entrepreneurship, and a lot of capital coming in. $2 trillion over the next 8 years, increase in spend for Asian healthcare. I think we all talk about chronic diseases. I already spoke about it in terms of oncology. But the thing we don't talk about as often in Asia, bar Japan, is aging. And this is a very interesting analysis done by NUHS, which shocked me, and I thought I would bring it to this room. So the definition of, the definition that NUHS has put out for aging societies is when 7% of the population is above 65, aged when 14% of the population is above 65, and super aged when 21% of the population is over 65. Europe and France and some of those nations took about 30 years to progress from aged to super aged. Many countries in South Asia, which are obviously talking about the young demographics, and in East Asia, are actually going to reach this super aged level in much shorter, in 20, 24 years, and not the 30, 40 years that Europe took. So as much as this is a young part of the world, we are running very quickly, racing very quickly to be aged and super aged societies. And on the right, there is a breakdown of some of the individual countries, even India, which obviously boasts of a demographic dividend, in just about 25, 28 years, is going to become an aged society. So just the solutions around aging and thinking about health span and not lifespan is also going to be a very interesting topic for healthcare in this part of the world. I think the third aspect, and Sunil referred to it, a lot of consumerism, I call it patient 2.0. There was an era where patient was a passive recipient of healthcare that was given to him and her. Today, you and I, we take much more active interest in our health. We are not passive, we are informed, we ask questions. Each one of us is wearing something or the other that tells us the number of steps that we are taking. In India, a smartwatch, locally produced, is now available for $10, maybe $12. So it democratizes the use of wearables. And this will, this means that every patient will be monitoring their own health, and they will be much more engaged in managing their healthcare. They will demand seamless experiences across digital and physical. Healthcare will never be fully digital, but they will demand seamlessness in their journey across interacting on digital and when they go to physical premises to seek care. So even the patient expectations are going to be very different than what it was in the past. And GenAI, how can I have a session on healthcare without talking about the most important defining technologies? Over the last couple of years, it has gone through a cycle of huge hype and then some moderation and expectation saying where is the ROI. My own belief is it is an upward trending line on how GenAI is disrupting almost every sector and most importantly healthcare. And in the early stages of this journey, it's always a bit of noise, a bit of up and down. But what you don't realize is that the curve is steadily progressing upwards. If you talk about pharma, the cycle that used to take 5, 6, 7 years to bring a drug to market after going through the long clinical development process, today many drugs have been brought to market with the use of AI in 18 or 21 months. And that is the amount of compression of innovation cycles that we're seeing with the use of Gen AI. The most routine tasks in a hospital setting in terms of writing, transcription, those are getting adopted. But also the number of AI-enabled robotic surgeries that are beginning to happen even in India is tremendous. So I, for one, am a big optimist. If there was one thing that we would, individually, I would like to put my personal wealth in, is technologies in AI and Gen AI that will fundamentally transform the way healthcare is delivered. And Asia, of all parts of the globe, needs it the most. The healthcare in Asia cannot be delivered the way it is delivered in the West. Asia can't afford to spend 20% of its GDP on health like US has. So I'm a big believer in this opportunity as well. The sobering part of that is that Asia is not one whole. Asia is one of the most heterogeneous parts of the world. We have countries which spend as much as $600 or $700 per capita on health, which is what you see on the right, China. And then we have countries on the left, like India, which spend $74, $75 per capita on health, and everything in the middle. And at the same time, on the vertical axis, most of the government is beginning to spend more and more on healthcare and beginning to launch more universal healthcare schemes. But we still have large parts of the population in these countries which pay out of pocket. And therefore, healthcare models will need to cater to both patients who are paying out of pocket and then consolidated buying power that is coming from state and central governments which begin to sponsor healthcare schemes. So with that, key trends in healthcare, I wanted to talk about specific subsegments. Overall, today we are sitting at about $1 trillion to $1.5 trillion spent in healthcare across all these countries. I've taken out Australia and New Zealand, that sometimes behaves more like the developed world than this part of the world. That's going to grow to about $2 to $2.5 trillion in just some time. And 4 key topics that I wanted to talk about, and where do therefore opportunities arise as this growth happens. And consultants love acronyms and frameworks, so I had to put something there. So I called it the grid. The G stands for growth, and I'll talk in a minute about why I believe in the huge growth. There's huge amounts of underpenetration of each kind of supply, and I'll share some data on that soon. R, which stands for almost a restructuring of the world order, which we're all seeing. I think the West, as dominant as it was, in terms of military power, in terms of cultural power, in terms of economic power, that whole order is changing. So there's a reordering of the world power, and Asia is benefiting. So that's what the R stands for. I is innovation. We didn't traditionally talk about innovation, especially in pharma, in Asia. That is changing. There's a lot of innovation and new molecular entities and new innovation, original innovation that's happening as well in Asia. And D is digitization, both in terms of the fragmented players that are there in the market, which digitization enables consolidation, and also digitization in terms of the patient journey and consumer and how they expect to receive healthcare. So with this grid, let me talk about each of these 4 factors. This is a chart which shows why I believe that there's going to be huge growth, the G part of the story. If you look at any metric, the number of beds per 1,000 population, the number of doctors per 1,000 population, each of these countries in Asia is below even the WHO standards. In India, we still have a huge shortage of beds, and that's why you see huge capacity still coming up, and that opportunity will be there for times to come, both from large established players, but also from smaller players, which are building single specialty plays or trying to expand into towns which the big players haven't gone. Doctors, which remains hugely short in India, in Indonesia, specialists for sure. We will never have enough manpower and doctors to serve the population, and therefore different models, hub and spoke, digital will need to come in. But what that also means is that today only less than 20% of the population in many of these countries, 18% in the case of Asia, for example, even gets treatment for something like hypertension. And that varies across country, but this population will need to get treated. So you can look at this picture as a glass half full, saying, that today there is a huge amount of underpopulation, or you can see this as a pointer to what can happen over the next 10 years, that all these people will need to get treated, all these beds will need to get added, and a huge amount of infrastructure, both physical and digital, will need to get built. So that is at least my vision of the growth, why I believe that there's going to be a lot of growth in healthcare in Asia. I think we already covered this. It will not all get done physically. It will get done in hybrid models between digital and in most countries in Asia, the one thing that has happened is digital is all pervasive. Almost the entire population, even in India, has access to either internet or smartphone, 60-70%, and in many other countries in Asia, even more than that. So all of this will not happen only physically. It will happen in hybrid modes. So there is going to be a lot of growth, and there's a bit of counter factor that there is a huge amount of medical inflation. In India, the recent report said as much as 14% per year. Healthcare is becoming costly. It's becoming costly because people after COVID are coming back to seek treatment. Capacity hasn't matched the demand, and there's a bit of imbalance in capacity and demand still. That is one factor, that there's a huge amount of medical inflation, which starts to put downward pressure on what you can price for your services. And also, there's a huge shift in the amount of spend, which is public versus out of pocket. In India, a 10 percentage point increase over the last 5 to 6 years itself, with Ayushman Bharat getting launched, in Indonesia with BPJS. And as this buying power becomes consolidated, again, it puts a downward pressure on pricing. As a result, huge growth, but downward pressure on pricing, new models will need to emerge. And at least four axes on which I think new models in healthcare services are emerging and will begin to emerge. Not all care will be in multi-specialty tertiary hospital for acute events. There will need to be distributed care, where care comes closer to the patient. We've seen some of these models, maybe some of you have used it, HelloDoc, Portia. Nervotech actually recently met this company, very interesting, with just any device which has a camera, which is most phones which have a camera, and with just a facial scan, they can give you your heart rate, your oxygen saturation, they can give you all the vital parameters. And so with just a camera, so much remote monitoring is able to be done. So healthcare is coming close, rather than you having to go to the hospital to seek care. Specialized care, and Quadria has already invested in a few, MaxiVision they were talking about, but many therapeutic areas lend themselves to vertical specialized care. Oncology, dental, eye care, Nephroplus, of course, Vikram is a dear friend, and these models will continue to proliferate. They are higher on return on capital, the capital required is lower, and they do really provide the right care at the right site for the patient. Value-based healthcare, a notion which has already taken hold in many of the OECD countries. Even in this part of the world, not entirely. I wouldn't say any model in Asia today is close to the North Star of value-based healthcare, Kaiser Permanente in US, but there are elements of that emerging in Asia, where there is group practice models, team-based doctor practice, focus on outcomes, measuring outcomes more transparently, or even trying to create some HMO models, early signs of that in India. But that is going to be a direction where it's not just fee for service, but you look at outcomes, or what are we delivering on healthcare to the patients. And finally, a confluence of funding and delivery to create closed loop models, where either insurance companies want to extend into OPD care and provide incentives for patients to have preventive health care, or delivery companies are moving into funding and seeing if they can create closed loop models to be more efficient given the medical inflation in healthcare. So four directions in which care will move out of multi-specialty hospitals, distributed, specialized, value-based care, and converging on the funding side. The second big trend, what I think there were usually two models of delivering healthcare in most Asian markets. Either premium pan-country chains, or very local, regional players with 1, 2, 3 hospitals, maybe a doctor-entrepreneur model. Now there is a big mid-market emerging, which provide a significant value proposition in terms of clinical care and patient experience, and at the same time are at a lower price than the premium chains. And they're willing to experiment, they're willing to go into tier 2 towns where there are fewer doctors, where price point and affordability is lower, and they're able to scale. So again, a lot of players across both delivery and even medical devices, where we analyze several categories, a lot of mid-market players will begin to come in, which provide a very good value proposition to both the patients and the doctors. And I would look out for some of these plays as well. So that was on the delivery side, a few sparks, a few vignettes for all of you to think about. Let me move to another part of the healthcare value chain, pharma. I think Sunil spoke about this already. It's a theme in your investment to look at plays where out of countries they can also serve the global market. India was already the pharmacy of the world, as Prime Minister Modi famously coined it during COVID. Now, if you look at another part of the opportunity, let's say in India, the overall contract manufacturing market globally is about 197 billion, about 200 billion. Of that, Asia is about 50 billion. India today is about 5 to 7 billion. So quite small versus the overall pharma market. But if you look at the India export and why India was coined as the pharmacy of the world, that's about a 25 billion market. So versus that, it's already a fourth, a third, the contract manufacturing market in India. And this trend is going to only accelerate, partly driven by China Plus One sentiment. The Biosecure Act was just passed, which obviously puts a lot of barriers for Western companies to outsource either research or development for Chinese companies. Each of them is looking for another option. A lot of them are coming to India. While a lot of capabilities in the contract manufacturing companies in India are today small molecule, they're all investing in new modalities. And both from that investment to begin to expand their capabilities, but just the sheer need for the Western companies and smaller biotechs to outsource parts of their value chain to lower cost markets, and where in India, for example, a hugely skilled workforce exists, this is going to have a lot of tailwinds. We did a recent survey with a lot of biotechs in the West. 70% of them do not want to consider China anymore to outsource their work. They do believe India is competitive. And the Biosecure Act, from one company alone, Wuxi, if you systematically analyze how much of their business is risk, there's a $2 billion opportunity open literally over the next 18 to 24 months that is up for grabs by the companies in India, in some of them in Indonesia, and so on. So this is a big opportunity, pharma services, outsourcing parts of the discovery and development value chain to India, especially in some of the other parts of Asia as well. I already spoke a little bit about this. A lot of this investment is going to come from new modalities. On the left, what you see is already 2 years ago, what we call new modalities. The top right chart crossed conventional drugs in terms of sales. And the pipeline today, 60% is in terms of new modalities. They're not small molecules. So the companies that begin to invest in these technologies are really going to benefit from this trend of outsourcing. You also see another picture on the right. Some of these technologies which are growing at 20, 30, 40% growth every year, peptides, ADCs, antibody drug conjugates, nucleic acid therapeutics, all sorts of new modalities. And companies which have these capabilities and are investing in these capabilities are bound to grow. Have already begun to expand into these capabilities. Suven, which acquired a company called Sapala to get access to oligonucleotides. Again, a very interesting technology which helps with gene therapies and begins to target hard-to-target diseases for which currently there are no treatments. Or Piramal Pharma, which has also acquired a lot of these capabilities. So big opportunity in CDMO outsourcing, but also coming to the third part of my framework of GR, moving to I, there's also finally a lot of innovation happening in Asia. Innovation, which means new molecular entities, original science, companies beginning to work all through the discovery, very, very expensive value chain and bringing new drugs to market. The preclinical assets in Asia has been increasing 2.5x over the last 5 years. We have a lot of examples in Singapore right here. where there are very interesting new drugs coming from small biotechs, also in India. There are 5,000 biotech companies in India now. I couldn't say this even 5 years ago. In Singapore, Hummingbird, which just raised $150 million for 2 very interesting assets that they're working on, and already have collaborations with the likes of Merck and some of the other companies to bring these to market. So finally, even the innovation ecosystem in this part of the world is coming together. So we usually spoke about India, Philippines, Vietnam as the outsourcing centers of the world. And that ecosystem has now developed to also contribute to innovation. So that's the I. And finally, the D. How can we ignore digitization? Satish is sitting here, MediBuddy, the first row on my different models of health tech that are emerging, horizontal. My own belief, and Satish will talk more about this, there's a lot of ups and downs in this. It's hard to make money. Scale matters, but there will be, at least in each of these markets, 2.5 players that survive. And that's probably happened across most categories. And while health tech takes longer to reach that point, there is an opportunity for 2.5 players to play these broad ecosystem plays. But the more interesting one is also depth plays, where you take a disease area and build a full stack solution enabled by digital. One of the most interesting things I heard is, and this is the space that is exploding, obesity. Even the GLP-1s actually need a lot of other solutions in order to get results. They have a lot of side effects. So to create a full stack solution focused just on obesity, for example, is an interesting play. The same for diabetes, which of course has existed for many years. The same for liver, which is a precursor to getting a lot of the diabetes, hypertension, or cardiac diseases. So vertical plays, and then health financing. So joining together delivery and financing, at least in markets which are still significantly out of pocket, are also very interesting health tech plays. So digital as well is going to offer a lot of opportunities. Currently, some of the companies are small, but the compounding plays a very important role, and very soon these will be large-scale players, capturing a significant share of the patient population. I think I finally end with an interesting view. All of your investors in the room. We do this analysis in BCG with a natural language processing tool where we look at all investments that have happened in a particular sector over the last 5 years. And I just had my team run this analysis. What you see in the middle is a lot of arrows, but each of them represents each investment that has happened in healthcare over the last 5 years. And then they're able to, through natural language processing, categorize them into where that's going. I would have expected that if you take a 5-year period, a lot of investment has still gone into traditional plays, hospitals, pharma. But what you actually see here, that is the largest investment, $3.76 billion over the last 5 years, has gone into digital health, some form of digital health. And then, of course, health services, which is hospitals and pharma and biotech, continue to stay strong. So those three at the big picture, zoom-in level, are still very interesting spaces, or at least that's what empirical data suggests, where investors have put their money. The more interesting picture comes when I actually begin to dig deeper. Beyond, for example, and some of this is hard, okay, it's easier to read here. It's hard to read. If you look at hospitals, obviously multi-specialty tertiary care still attracts a lot of investment. But some of the other interesting spaces that have started to attract investment, IVF, big trend in India, infertility, or elderly and nursing care. I spoke about aging, which is already a very prominent trend, even in young countries like India. Skin and hair treatment, so consumerism, that has also attracted a lot of investment. Some of the counterintuitive ones in pharma and biotech, stem cell research, functional foods, nutraceuticals, drug discovery, beyond what you would expect, which is APIs, which has always been big, for example, in India. Similarly, on digital health, we would expect some of the telemedicine, virtual care platforms, but also mental health has attracted a lot of investment. So just a bit of sparkling of where the investments have gone over the last 5 years. If you look at literally every investment that has happened in this part of the world over the last 5 years. And then I also tried to look at, if you only take small ticket investments, so investments less than $5 million, what does that data look like? And the reason I did this is it's, the foresight isn't looking at weak signals. Of course, the big ones we already know. But if we look at weak signals saying where are early sparks, that may provide us more foresight into what may be developing in the future. And if I look at all investments, less than $5 million over the same time period, what you begin to see is a lot of AI ML based healthcare platforms. What you begin to see is elderly, nursing care, physiotherapy. So again, interesting food for thought. As investors, you need to have that foresight 7-10 years later. I think these are weak signals for you to pick up. This is where the world is starting to show some sparks. So that is what I had to share. I think if I go back to this lens of growth, reordering of the world structure, innovation, and digitization, these are some of the themes in summary across the different healthcare sectors, which I think are very interesting from an investing lens. If you think of healthcare services, tertiary care still will be there. There's still a lot of room for growth. But beyond that, there's mid-market players, like I said, players emerging in the middle of premium and local. There is elderly and nursing care. There's diagnostic services. Those, I think, are interesting themes. If I come to pharma and biotech, active pharmaceutical ingredients remains a big area as many countries try to reduce their import dependence on China. There is CRDMOs specifically for new modalities, like I said, beyond small molecule, which is very interesting. AI-based drug discovery, which is already happening and will fundamentally change the R&D value chain in pharma, and even stem cell research and therapy. Those are interesting themes. MedTech, which we didn't speak about a lot today, but there's a very interesting opportunity again in India and some of the other markets to localize the value chain. They are 70-80% dependent on imports today. So MedTech is probably 20 years behind where pharma is in some of these markets. Point of care, which brings again diagnostics closer to the doctor or to the patient. AI-based imaging, going back to the talk of Gen AI. And then digital health, both vertical, disease-specific platforms and some horizontal plays, and then integration between funding and delivery would be some themes that I would put on the table for all of you to consider. But overall, in summary, there's a huge opportunity. $2 trillion is going to be spent over the next few years in Asian healthcare. A lot of interesting models emerging. So Asia definitely is the place to be in terms of looking for interesting models and creating social impact and creating value for yourselves. Thank you.